Sherry, thank you very much for joining us. You're joining us all the way from New York City, and it's pretty late where you are, but thanks for doing this for us, Sherry. So, what we want to talk about today is basically delve into what patient blood management is. Now, generally, people know what patient blood management is, but Malaysians, I did a bit of a survey speaking to a few people, and I asked them, do you know what patient blood management is? I even asked very young doctors, and they said, no, I'm not too sure as to what that is. So some might say that there's, it might be a sort of a generalization here, but I think that not many people in Malaysia are still in the know with regards to what patient blood management is. So uh, basically, where do we begin with this conversation of patient blood management?
Yeah, so I mean, and thank you for having me. It's so nice to be here, and I appreciate the opportunity to talk about this topic, which is very important for health of not just Malaysians, people all over the world. But patient blood management, really, just to define it, to start the conversation, is really this organized, patient-centered approach to really managing a patient's own blood by specifically looking at the issues that might affect their blood and keeping their blood healthy. And so, we really try to emphasize the fact that the blood is actually a liquid organ. So we're very familiar with other organs in our body, kidneys and heart and lungs and liver. But we don't often think of the blood as an organ, but it really is the body's liquid organ. And patient blood management really focuses on keeping that blood healthy and treating any problems with it.
Mhm. Now, recently in Malaysia, I've seen quite a few awareness campaigns in the medical fraternity with regards to patient blood management. I know a couple of anesthesiologists who are now even talking about it at this point. But what's more important is that there was recently a policy brief on this by WHO, and maybe you can walk us through what this policy talks about and how it affects us everyday people who are not within the medical sphere.
Sure. Yeah. So, as you said, the World Health Organization saw this topic important enough to put out this policy brief, which really gave direction to all of its member states to do something about this issue of patient blood management. And again, that may not be exactly the same, right? Because countries' abilities and resources may be very different. But again, really focusing on the patient's own blood, what it helped to emphasize was that there are almost 3 billion people around the world who are dealing with anemia, and more than 600 million are dealing with some issues related to blood loss or bleeding. So if you go back to that first number, almost 3 billion people, right? It's a large proportion of the world's population dealing with anemia. It's so common that many physicians and nurses and hospitals around the world don't even pay attention to it. It's just sort of considered part of the normal state for patients. But the reality is, if we just look at anemia as one of these issues that affects the body's liquid organ, affects the blood, and anemia, just to define it for the non-medical folks, is when the body doesn't have enough red blood cells, or the red blood cells are not functioning well enough, or they don't have enough iron or hemoglobin to do their job. That really has a tremendous impact on people, even people who are not yet patients or going into the hospital, just in everyday life, right? It causes tiredness and weakness, lack of productivity in the workplace, overall feelings of not feeling well. It's so common in pregnant women and in children. And for pregnant women, it affects their whole pregnancy, but it affects that infant too, that fetus, and it affects for years into the future that child in terms of learning abilities. Um, it's when patients do have, or people do have anemia and it's not treated and they go for surgery either by choice or by chance, there's good scientific data that tells us that they're going to have poorer outcomes from that surgery or from a medical problem because the anemia is not treated. And for most of those patients, it's very treatable. So what this World Health Organization document or policy brief really said is, we as a global health community need to pay attention to this condition that's so common, yet we don't pay attention to it. And there are millions and billions of dollars and days of quality life that we're losing, and our populations and countries around the world are losing because of not treating this very treatable problem. And part two was really this other portion, which addressed bleeding, chronic bleeding and blood loss and bleeding disorders from any variety of reasons. Again, these are things we can do something about in many cases, but we as a medical community have spent many years talking about blood transfusion or replacing blood when someone clinically needs it. We have spent not enough time at all talking about the patient's own blood and how to keep it healthy and how to keep it strong and how to treat its problems. So that's what that World Health Organization policy brief said, is do something about the patient's own blood, because we can, and we can affect real change and make people's lives much better.
Right. So Sherry, if I'm going to break this down to simplify this a little bit more, just so the everyday people here in Malaysia understand what patient blood management is. It is essentially taking the patient's blood and working on it in a way which they can use it again. Is that what it is, or how do I?
Sure.
Yeah.
So to make it very, let's take a very simple example. About 40 or 50% of patients who show up for surgery at a hospital are anemic. They don't have enough red blood cells, or they're not working well. It's about almost half the people that don't even know they have a problem, right? And if they show up for surgery and they're anemic, or their blood is not what it should be, they're going to do worse in surgery, right? Just as an example, they're going to do worse in their hospitalization. So patient blood management, in part, is paying attention to that patient's own blood before there's a problem, as part of their normal primary care, or if we only find out about when they're ready to have surgery, treating it then. So taking care of their own blood. And then, as you pointed out, what we also can do is use that patient's own blood during surgical procedures. For example, a patient's own blood can be collected and cleaned and returned to that patient, right? Instead of thrown away or discarded as it could be. So those are examples. There are many others, but those are examples of patient blood management, where we treat that patient's blood as this precious resource, and we take very good care of it, and we make it as healthy as it can be as part of normal life. But especially when there's a medical problem, we make sure that we take care of patients' bleeding and anemia.
Okay, so if we look at it through the looking glass, this looks like a game changer for everyone. Now, the biggest problem is, what I don't see here is what does primary healthcare, or what is the role of primary healthcare in ensuring that enough information is disseminated, and when it comes to dealing with your own blood, or keeping the health of your own blood, how does this happen at primary healthcare level?
Well, we think there's a couple of elements to answer that question. Is really, one is the role of the patient themselves, right? So we want information, as we are spreading today, right, to the public. We want people to be concerned about their own blood health. We want them to ask questions about that, the way they may ask their primary care doctor or primary care health provider questions about a lot of things in their health. We want them to also ask about their blood health, and not accept that anemia is normal. And many times patients don't even realize they're a problem because their healthcare provider is acting like there's not a problem. So we want patients to be educated that anemia is something that people can do something about. In most cases, it's treatable and correctable and will make their lives better. But we also need to teach those primary healthcare providers that it's not just a normal part of doing business. Sometimes they see it so commonly, again, especially in women and children. So many patients have it that they look at as what we call a normalized abnormality. They don't even pay attention to it anymore, right? And that's really what we want, as well as, just in general public awareness that taking care of our own blood will make, again, our economies better, the lives of our citizens better, our individual patients better. So it's part of the responsibility both of patients, we hope, to educate themselves where they can, but also those primary care providers to not see this as just something normal. It's not normal if patients' blood is not healthy. It's not any more normal than if their kidneys weren't healthy or their heart wasn't healthy. that primary care doctor would say, we need to do something about this. We need to send you to a specialist, or we need to pay attention to this. It's not just because I see it all the time doesn't make it normal. So we want our primary care doctors to see it, that it's important to take care of patients' blood.
So basically, some of the red flags that people usually look at is fatigue, tiredness, so on and so forth. And you go see your primary healthcare physician, and what needs to happen at this point? Blood work needs to happen to ascertain or establish where you are. But over and above that, what does one have to do in order to get this done if the healthcare provider doesn't see the need for blood work? Okay, so you walk into a small clinic in Malaysia. Just to simplify it a little bit more, you walk into a small clinic, you pay about, say, $10 US, you get treated, and you say, look, I'm tired, and do you think I need to check my blood levels where they are? Would that be a valid question to ask your doctor at this point?
Absolutely would be a valid question. And again, there's many things, right, that are going to be revealed by the health of a patient's blood. For all kinds of medical conditions can show themselves. So standard blood work, if resources are available, would be a normal part of primary care at whatever appropriate interval when patients go for a checkup, or they go to a clinic, or they go to their primary provider. That would be completely appropriate. And again, I don't know everything about the healthcare system in Malaysia, but I imagine that that is fairly common for patients to go for regular medical care and have blood work looked at as part of a picture of their overall health, if those resources are available. So, the challenge with patient blood management is what we see all over the world, is that patients have the access to blood work, or the primary care doctors, or even specialists have the access to blood work, but they don't pay attention to the results when it comes to this particular issue. So they may see this anemia in patients, or they may see a problem with potential for bleeding. But in the minds of many doctors and nurses around the world, they think, well, if the patient ever has a problem, they can have a blood transfusion at some point down the road, so I don't need to really pay attention to this right now. And what we are saying in patient blood management is, yes, you do, because it's going to, again, make their lives better and healthier. So we want patients to, where they can, advocate for themselves. Yes, to my primary provider, to my doctor, please do look at my blood work. Please do pay attention to it. And please treat the problem, because for most patients, if they are anemic, and we talked about not having enough red blood cells, right? For most patients, that's just a matter of iron deficiency. And that's very, very easily treatable. Even in very low resource countries, it's something that can be treated. We just don't do it. We just don't pay attention to it. But
right. Therein lies my problem. You see, so iron deficiency is something very easy to pick out, but yet we don't call for that test to happen. It doesn't happen. Why is that? Is there a slow take-up rate with PBM around the world? People have been talking about it. In Malaysia, there's a movement. Sure. But I really don't see a lot of vigor in wanting to make this happen fast enough.
I agree with you. And it's one of our, I won't say frustrations, one of our challenges in the patient blood management medical community is once someone understands it, whether it's a medical person or a lay person, once they understand this concept, they react exactly as you did, Gerard, which is sort of, well, why don't people get this? It's not very complicated. It just makes sense. Why wouldn't we want patients' blood our own blood to be healthy? Why wouldn't we want to control bleeding? Why wouldn't we want to make best use of our own blood? Why shouldn't we? And we're getting there, right? This World Health Organization policy brief is one huge step in this direction. But we in the patient PBM, as we call patient blood management world, are working to the extent we can to publish things in the peer-reviewed medical literature, in medical journals, in nursing journals, to raise awareness, as well as have, again, public awareness. Because, again, it's something that has become, the problems of blood are considered so normal and easily correctable later on with the transfusion that clinicians don't really pay attention. Now, that is changing for a number of different reasons here in the United States, as an example. And not just here in the United States, around the world, because of this pandemic, there's a massive shortage in components for blood transfusion. And as a result, clinicians are, at least here in the United States, I know in some other countries, are being forced to think about patient blood management. Now, we wish they had thought of it already, right? And the things that they do to deal with the fact that they may not have blood to transfuse is we're trying to tell the lessons, like teach them the lessons to say, these are the things you should have been doing anyway, and you should keep doing anyway. So it's a slow uphill climb with PBM, although it's so logical. We keep having to ring that bell and make both the public and providers aware that it's just logical and it's just good medicine, and it's not necessarily expensive, and it's not necessarily unavailable even in low resource areas. This can be addressed, and it will make people's lives better.
Right. So if we were to place emphasis on patient blood management and run it as a program, what is the cost behind it? Is there a lot of money? And say in the United States, are there funds coming from the federal government in order to make these programs available?
No, not necessarily. They're not in the United States. It's not a government funded initiative. There have been countries around the world, such as Australia and the state of Western Australia, where there was government support with resources to help study this. But really, what we say about patient blood management is, 80 or 90% of it happens between the ears. It happens in the way that physicians and nurses and hospitals think about how they approach patients. And proactively taking care of a patient's own blood many times doesn't cost any more than not doing it. And some of these therapies, like replacing iron, can be very, very inexpensive. It can be even just dietary changes, again, if people have access to adequate nutrition. So, implementing these types of programs don't cost, billions and billions of dollars. Many of the principles of patient blood management are really very simple. They really are. They fall into three really categories, which is managing that anemia and iron deficiency, minimizing blood loss where we can, and really leveraging a patient's own liquid organ of their blood. And really, most clinicians in most settings have the tools to already do all this. They just have to use their brains to proactively think about how to take care of that patient's blood and look at that as a precious resource, not something that can be easily replaced by something from a blood bank. And if we really thought of blood again as a liquid organ, we wouldn't treat it lightly, right? When patients have heart failure, the first thing we do is not say, well, let's find a donated heart and implant a new heart, because that's a very, very precious resource. It's very rare that we can have some poor person or family who's donated an organ under a tragic circumstance. So before we replace that organ, we do all kinds of things, right, for that patient. We use medical therapy, and we make lifestyle changes and dietary modifications. We do all these things. And then if none of those things work, a small percentage of patients will have that organ replaced, right? Might have a heart transplant or a liver transplant. We don't do that with blood. Many clinicians think, well, if the patient gets sick, there's always blood to transfuse. And we don't take care of that liquid organ. So again, it's quite simple, but it really happens again in the clinician's brain. So it's not expensive to implement PBM, and it saves money ultimately for government healthcare systems.
Right. Sherri, out of curiosity, what does it cost, or what does it take to train stakeholders within civil service, or medical providers within the civil service, and also the private sector, to be savvy with regards to patient blood management, to at least know the basics of patient blood management?
Yeah, it doesn't cost very much at all. Again, there's so many of the principles of patient blood management are out there already. It's just that they are not organized in a way where clinicians really recognize this as a specialty in of itself. They may learn a little bit about anemia as part of their medical school training. They certainly learn about bleeding. They learn about these different things, but they don't learn about it in an organized fashion. So there are a number of different organizations around the world that are making an effort to address that. The organization that I am part of, the Society for the Advancement of Patient Blood Management, has what we call a certificate course, a one-day course for clinicians, even non-clinicians, non-medical professionals are welcome to sit for it. But we encourage our physician and nursing colleagues around the world. It's one day that really gives them, from the very beginning, ideas to a more advanced concepts in patient blood management. And again, it's many things that they already know, but it's really putting it together in a way that, again, they use their own brains to put together the information to really prioritize these aspects of patient blood management. The International Foundation for Patient Blood Management, centered in Europe, has done a lot of work, again, in creating resources. These things are, for the most part, available online at very little to no cost. So, those websites and those resources are available to medical professionals all over the world. It's, again, really focusing their minds and paying attention. It's not costly to learn, and it's not costly to implement.
Right. So when we look at what you're talking about, take into consideration what work has been done and what can be done to better the healthcare system. Also, I'm looking at the economy and how this will lessen the burden on the economy. Am I making sense here?
Absolutely.
Yeah.
Absolutely. There's a huge economic aspect to it. Again, in this world we live in, we also have to follow the dollars and see where they're being spent and where they can be saved, and how that impacts things. And the probably the most well-studied example was the program in Western Australia, where they really looked at not just clinical outcomes, which are tremendously important. We want patients to do better, right, from a medical perspective. But in the process, they really showed that there was a tremendous cost savings over the 6 years where they studied the implementation of patient blood management just in that one really relatively small geographic section of Western Australia. That content, they saved almost $20 million in blood component costs. But again, there's a much larger implications. It's not just what it costs to buy a unit of transfused blood. What about the costs of actually transfusing that blood, which we could have avoided if we really did patient blood management? So really, the savings were, for that, just that one small 6-year project, were, close to $100 million in savings. So, multiply that over larger countries, larger continents, larger health systems. That's just the savings in not transfusing. When we talk about the clinical or the medical improvements, where people stay in the hospital less time, they have less complications, they die less often, right? All those things cost a lot of money when patients have complications, or they stay in the hospital longer, or bad things happen to them after or during surgery or medical care. Those are really millions and billions of dollars that are avoidable costs. And that's what patient blood management really focuses on, is the avoidable costs that we can do by really doing the right thing with the tools we already have. We just have to use our brains to apply them. And again, implement some systematic, organized approaches to doing this, which involve patients being, again, empowered with information and being their own advocates, but also our medical providers having that information for our patients.
We've got about 2 minutes left on the show, Sherri, and before I let you go, this is the important part of the show for me, when we send out a message to the public with regards to patient blood management, also to practitioners within the medical industry, fraternity, doctors, nurses, everyone, all stakeholders. What is your message to all of us in 2022?
The message for 2022 is that we need to treat the patient's blood, or their hematologic system, their blood system, with the same respect that we treat every other organ system. And if something isn't right, we don't treat it as normal. So for patients, ask the questions. If something in your blood work is not normal, if your blood count or your hemoglobin level when you have your blood test done is low, and that number should be around 13 or 130, depending on how you measure it in Malaysia or whatever country. If it's not normal, speak to your healthcare provider, speak to your primary provider about what you can do to treat that, what's causing that. It's not normal. Just because they see it all the time, it's not. And to our medical community, pay attention to patients' anemia and bleeding. Preserve that patient's own blood. Treat that organ with respect, because it's precious. We can't replace it.
All right. Sherri OZAWA, immediate past president, Society for the Advancement of Patient Blood Management. Thank you for this.
Thank you so much for the opportunity. It's great to be here.